Hello everyone, and welcome back to the Medigap Show, the channel where we break down all the complexities of Medicare. I'm your host, Holly Cohen, licensed agent and founder of MedigapCares.org, a nationwide agency. Every day we try to help those on Medicare or beginning Medicare make the most informed Medicare decisions possible for themselves. Our home office is in Florida, but we are licensed across the country. We represent all of the A and A+ Medigap insurance carriers, and our services are always free to you. Today, I want to address an important topic specific to the New York City retirees who are facing a big challenge right now. This story grabbed my attention since the beginning. As a licensed agent working in the Medicare area for so many years, I find it shocking that this is happening. Whenever in the past, if I was asked about the NYC retirees plan, because I do speak to a lot of retirees that live down here in Florida, my response has always been that it is the best retirement plan out there next to the federal employees plan that the federal workers get. And it is the best because it keeps you on traditional Medicare, what you have currently with your plan through the city. I have helped many retirees from other unions and many large corporations across other parts of the country who have also faced the same challenges that the NYC retirees are now facing. The retired teachers, firefighters, and all of the NYC union members, either I or my husband Steve have spoken with, who are still either living in New York or other parts of the country, it has become clear that these individuals have been facing significant challenges with this radical change to their retiree plan. In a previous video, I covered the different rules about Medigap in each state, and I'll include a link to that video in my description below. Today, I want to discuss an article that I came across from The Gothamist that addresses the approaching deadline that could impact the retirees in New York City. Let's dive into the article and explore this further. So here we are. This article was published on Gothamist. It's written by Caroline Lewis, published this morning at 10 a.m. So what 250,000 NYC retirees can expect from Medicare Advantage as opt-out deadline approaches. So the author here, she uses the term opt-out. I don't think that's the correct word that you guys need to be using. So please go back to your unions and understand, I believe the word is waive, but opt-out is always an insurance term, and it's just not, I don't want it to confuse any of you all. So I'm going to include links below where you can find your information that you need. Tens of thousands of retired New York City workers and their dependents have until Monday to decide whether to opt out of a new privatized Medicare plan that's slated to replace their existing coverage in the fall, after the deadline was extended last month. Otherwise, they will be enrolled in the new Aetna-run health plan automatically, a fate that some retirees are dreading despite reassurances about the quality of the plan from the insurance provider and city officials. New York City seniors are grappling with this potential shift in their health coverage, which has been delayed for years amid protests and lawsuits at a time when these private Medicare Advantage plans are exploding in popularity nationwide. Until now, most municipal retirees have been covered by traditional Medicare with a supplemental plan called Senior Care, paid for by the city. The only way for retirees to stay on traditional Medicare would be to forego city health benefits entirely and pay for any supplemental coverage themselves. Gothamist spoke with New York City doctors as well as seniors and their family members about how their own experiences with Medicare Advantage plans stack up to the hype and the critiques, what doctors have to say. There's now a wide variety of Medicare Advantage plans on the market. They frequently offer a broader array of benefits than traditional Medicare, but some have narrower networks of healthcare providers and have a reputation for making people jump through hoops to get the medical care their doctors recommend, said Tricia Newman, Executive Director of the Program on Medicare Policy at KFF, which is Kaiser Family Foundation, a healthcare research nonprofit. Aetna has stated its plan for NYC municipal retirees is designed to minimize those issues. But 3 New York City doctors who spoke to Gothamist said, given their experiences with other Medicare Advantage plans, they understand why people are concerned. Dr. Thomas Sterry, a plastic surgeon affiliated with Mount Sinai, said he often helps with touching things up after a patient at the hospital gets a major surgery done, and those procedures can require inpatient rehab after the fact. Sterry said he can readily send patients to a rehab facility if they're on regular Medicare, but that, quote, the Advantage plans never approve it, unquote. They force us to send the patient home. That was the quote by Dr. Thomas Sterry, plastic surgeon. He added that these denials even happen after multiple clinicians recommend the inpatient rehab. They force us to send the patient home, and they expect the patient to get some in-home physical therapy twice a week or something like that, Sterry said. It's not even close to the same thing. Dr. Alex Steinschluger, a Manhattan urologist, said he doesn't actively participate in any Medicare Advantage plans because he finds them too time-consuming. But he said patients enrolled in those plans are sometimes able to see him even if he's technically outside of their network, something Aetna stated will also be possible for seniors in the city-sponsored plan. When Steinschluger does see patients on Medicare Advantage plans, he said there is often a lot of extra paperwork involved, even for routine procedures. Often, he said, procedures that require prior authorization are eventually approved, but they could be delayed by weeks or months as patients await the green light from their insurer. Dr. Lauren Wisner-Green, an endocrinologist in Manhattan, echoed these concerns. We call it Medicare disadvantage, Green said. That's a common parlance in the medical community. Aetna and city officials have tried to alleviate any concerns and differentiate the plan for New York City retirees from other Medicare Advantage plans, which are also offered by major insurers. Medicare Advantage plans have expanded to cover about half of all Medicare-eligible seniors in the United States. Part of how Medicare Advantage plans keep costs down, in general, is by requiring prior approval for a greater number of services than traditional Medicare, according to Newman from KFF, Kaiser Family Foundation. Her organization reported earlier this year that Aetna's Medicare Advantage plan had among the highest denial rates for medical services that were subject to prior authorization in 2021. But Aetna has agreed to cut back on the types of services that will be subject to that kind of scrutiny under its plan for New York City. The insurance company states that it is also trying to maximize its network. While city officials testified on the Aetna plan at a city council hearing earlier this year, they said about 85% of the doctors who accepted senior care, the plan the city currently pays for as a supplement to traditional Medicare, would also accept the new coverage. They added that another 10% said they would see patients on Aetna's Medicare Advantage plan even if they were not in network. But some retirees said that they have talked to their doctors and they were told they would not participate in the new plan. That's what Lance Michaels, a 76-year-old former employee of the Department of City Planning, said he heard from his general practitioner who treats him for type 2 diabetes. Michaels, who lives on Long Island, said he likes his existing coverage and he doesn't want it monkeyed with. I don't pay for anything and the service has been good, and all the doctors I use accept it, he said. Why Medicare Advantage is so popular and what patients say about it. Despite being subject to growing scrutiny by the federal government, Medicare Advantage plans have expanded to cover about half of all Medicare-eligible seniors in the United States. These plans tend to advertise widely, and while federal officials have expressed concerns about misleading marketing, Newman said the offerings appeal to many seniors due to extra benefits that are not covered under traditional Medicare. Advantage plans can also be cheaper than buying a supplemental plan to fill in the gaps, and some find it simpler to have all their health benefits on one plan, she added. At the same time, Medicare Advantage plans have become a popular choice among the shrinking number of employers that still offer to help pay for their retirees' health benefits, meaning the NYC municipal retirees are not the only ones being ushered away from traditional Medicare and onto these plans by forces outside of their control. Newman said that most of the time when people are initially denied care under a Medicare Advantage plan, the decision is overturned on appeal, but she added that it still creates a barrier to people receiving services that their doctor intended for them to receive. The appeal process also takes time. My job was dealing with the insurance company, was the quote from a son of a Connecticut senior who was diagnosed with ALS. The son of one Connecticut senior who was diagnosed with the neurological disease ALS said he experienced this phenomenon while trying to work with his mom's Medicare Advantage plan. He asked to remain anonymous because his mother died earlier this year and he is still working with her insurer and health providers to get her estate in order. He said his mother required an extensive stay in a nursing home after being intubated in the hospital. He was initially relieved that she was on a Medicare Advantage plan because it provided unlimited days in a nursing home, while traditional Medicare only covers up to 100 days. But he said despite its ostensibly generous benefits, the Medicare Advantage plan only approved his mother for a few weeks in a nursing home at first, and he had to go through an arduous appeal process to get her stay extended. My job was dealing with the insurance company, which required countless hours on the phone, he said. Not everyone on a Medicare Advantage plan has experienced these issues. According to Aetna, a survey of current New York seniors on its Medicare Advantage plans indicate that 92% are satisfied with their coverage. Morris Altman, who previously worked at Queens College, is entitled to health benefits through the city. When he retired a few years ago, he enrolled in a different Medicare Advantage plan that's already offered as an alternative to senior care. He said he's been trying to reassure fellow city retirees that it has served him well. He has a quote, "I've had MRIs done, no questions asked," Morris Altman, Queens College retiree. "I've had MRIs done, no questions asked," Altman said. "I've had all sorts of visits and specialist physical therapy, no questions. I haven't had surgery. Let's hope I don't need that ever, but if I do, I expect I'll get it without much trouble." A few New York City retirees who contacted Gothamist said they will make the switch to the new Aetna plan despite their concerns because the premiums are covered by the city. The other two retirees emailed Gothamist to say they were planning to opt out, and again, the word is waive benefits, from my understanding, but again, I am not part of that. I'm not part of that organization, so I don't want to misspeak, but this article, I believe, is incorrect in how it's stating that word. But we're waiting until the last minute to see what would happen with a pending lawsuit that aims to block the change. Mitch Schwartz, a spokesperson for Aetna, said as of Friday, 1,667 of the 250,000 or so seniors who are affected had opted out of the new plan, although he didn't say how many are switching onto another city-sponsored option and how many are waiving their city health benefits entirely. The article explains that retirees need to carefully consider their options as the deadline approaches. It's crucial for them to assess their health care and evaluate whether Medicare Advantage plans or traditional Medicare aligns with their specific finances, healthcare needs, and requirements. NYC retirees and retirees in general should carefully consider their healthcare needs and evaluate whether waiving benefits from a Medicare Advantage plan aligns with their individual circumstances. Medicare Advantage plans offer additional benefits, but they also come with limitations such as networks and specific rules. For retirees considering waiving benefits from Medicare Advantage, exploring alternative options like Medigap plans becomes crucial. From those considering waiving benefits from Medicare Advantage, exploring alternatives like Medigap plans can provide more flexibility in choosing healthcare providers. Please remember, different states have different rules when it comes to the Medigap plans. As I explained in my previous video, it's important to understand these state-specific guidelines and requirements in order to make an informed decision for yourself. In such a challenging time, it's essential for the retirees to seek expert advice and guidance and stay informed. Reach out to trusted resources. We're here to help guide you at Medigap Cares. Our team of licensed agents are well aware of what's happening and prepared to help guide you through the process so that you are prepared on September 1st. We're here to provide you personalized assistance and help you understand your options. By working with a licensed professional who specializes in Medicare, you can gain valuable insight and clarity, enabling you to make informed decisions about your healthcare coverage. Remember, this is a crucial time for the New York City retirees. It's important to stay informed, evaluate your needs, and make choices that align with your healthcare requirements and preferences. As we conclude this discussion, I encourage you to take advantage of the resources available to you. Check out the links I've included in this description below. I've also included the link to my previous video about the state-specific Medigap rules. Thank you for joining me today as we explored the important topic of traditional Medicare and what the New York City retirees are facing at this time. If you found this video helpful, don't forget to subscribe to the Medigap Show. You have the power to make informed decisions about your Medicare. I know it's not easy. Feel free to give us a call at 855-265-6334. We at medigapcares.org are here to help you. Also, you can go onto our website, medigapcares.org. When you go on there, you can book an appointment with either me or with my husband Steve or one of our other trusted agents. Stay empowered, stay informed, and take control of your Medicare. I'm Holly Cohen. Be well.